Hi, I'm Dr. Michelle Bengtson. In my practice, I deal with all sorts of disorders, from ADHD to depression to dementia. And so often, my patients, once they're diagnosed, I offer them the opportunity to ask me any questions that they have. But whether you're diagnosed with cancer or dementia, frequently you don't know the questions to ask because you haven't been through it yet. Today, we're going to ask and answer some of those questions when it comes to dementia that you might not know to ask. In this situation, we've been through the situation of dementia and being a caregiver, and it's a very difficult situation to be in. I'm just wondering, you've been through that situation with your wife, and I'm wondering what was the most difficult thing that you had to deal with in going through that situation?
Well, there were many difficult situations, but I think the most difficult ongoing situation was that my time was no longer my time. My time was just filled with distractions of one type or another, where my wife would maybe bring the coffee pot and put it on a keyboard on my computer, or bring the newspaper in and putting it in front of the screen, and many other interruptions such as that.
So then you had to change your focus from being what you were focused on to what the current situation was.
Right.
And it often didn't make any sense.
Right, and then I had to start all over again.
And over again.
And over again.
And over again.
Right.
Yeah. Was there anything that you figured out to make those situations easier?
Let me just reverse that question a little bit. Some of the things that I did wrong. Because now, looking back on it, I realize that many of those interruptions were really an act of love. When she brought me coffee or the newspaper and those kinds of things, although I didn't need them and I didn't want them, yet she brought them either to demonstrate her concern and love for me or to get attention. But sometimes it made me very angry because it was interrupting my work.
Sure.
In fact, occasionally, fortunately not very often, but sometimes I was even so angry that I yelled at her. And I can imagine her reaction now when she was trying to do something to give me something or be kind to me, and then she was greeted with an outburst of anger.
Sure. So now, knowing what you know, because you didn't have the benefit of that information back then, what advice would you give someone who is in the early walk being greeted with such displays of interruption, which were really affection?
Just patience and understanding, but mostly just patience and gritting and bearing it.
Thank you for sharing that. So can I just encourage you today, if you're in the early stages of finding out that a loved one has dementia, do what you can to find out more information, to be understanding and recognize that this is not something that they're doing to try to be an interruption or to frustrate you. They don't know any better. For more information and to find out more tips, go to my website, drmichelleb.com. God bless you.